Hi, everyone. Thank you so much for tuning in to From Behind the Physician's Desk with both Dr. Sood and Dr. Cornish. And first, we would like to start by going around and introducing the lovely clinic outreach team who's here with us today. So my name is Kathleen Inoa, and I work for the Amen Clinics as the East Coast Outreach Manager.
And I'm Donna Lalwani. I work in clinical outreach with the Amen Clinics, New York.
Maria Luby, Washington, D.C. Clinical Outreach Manager. We're located in Reston, Virginia.
Awesome, and I'm so excited to be here with you all today. And shortly, Donna and Maria will be providing a little background on the two amazing physicians that we have joining us here today. But for those of you watching that may not be too familiar with our clinic, Amen Clinics is the leader in using brain imagery, which we call SPECT scans, to help treat emotional issues, behavioral challenges, cognitive problems, and learning challenges. Our SPECT scans capture areas of the brain that are either working well, working too hard, or not working hard enough. Our founder, Dr. Daniel Amen, started the company about 30 years ago and has opened 8 clinics throughout the country. We have also developed a database of about 170,000 SPECT scans. So our doctors use the research developed through our database to assess our clients using a brain systems lens. The treatment is holistic, it's integrative, and individualized to each brain. Psychiatry is shockingly the only medical field that doesn't look at the organ that's being treated, and at Amen Clinics, we're really trying to change that by just finding the root cause of a client's presenting problems rather than treating them through a list of symptoms that they report. Our mantra is literally, how do you know if you don't look, right? So Donna, would you like to go ahead and share a little bit about what's going on here during our time together?
Absolutely. Thanks again, Kathleen. So I'd like to share about the structure for the program, and of course we'll be introducing our doctors. And this is, of course, an opportunity for a live Q&A session. So we welcome you to From the Physician's Desk, a real-life case evaluation review with 2 of our Amen Clinics experts. We'd like to share the Amen Clinics method and approach with this special evaluation case review walkthrough. It's a behind-the-scenes look at a comprehensive full evaluation with integrative services so that we can reveal the process with detailed treatment recommendations. This is designed to provide context for you from end to end on the client's clinical history, brain health assessments, insightful results of the functional brain SPECT imaging, along with the integrative and functional medicine labs and treatment plan recommendations from both of the lenses of Dr. Rishi Sood and Dr. Eboni Cornish, from what we can do as a partnership with our professionals. And we're here to share about this fascinating case so that you may consider how this may apply for your patients. We will allow time for the program for your questions and answers following the clinical case evaluation. And we hope that this experience may allow you to reframe your perspective on diagnostic resources, tools, and treatment protocols to support your practice and change the lives of your patients. So again, after the presenting case, we'll open up with a live interactive questions and answers. So I would like to share the bio for our first physician speaker, Dr. Rishi Sood. Dr. Sood has worked at the Amen Clinics, New York since 2014 and serves as our Associate Medical Director, where his current focus involves improving patient outcomes and retention within our system of care. He's board certified in adult psychiatry as well as child and adolescent psychiatry. In addition, he's board certified as a pediatrician and is medical director of our conscious sedation program at the Amen Clinics, New York. Prior to joining Amen Clinics, Dr. Sood trained at Mount Sinai Medical Center in Manhattan, where he served as chief resident of the Triple Board Residency and Fellowship Program. Dr. Sood values working with adults and children across all age ranges. He's experienced in mood and anxiety disorders, brain injury, PTSD, ADD and ADHD, addiction, impulsive and disruptive behavior disorders, autism spectrum, psychotic disorders, and OCD. He uses dynamic as well as cognitive behavioral therapy, interpersonal psychotherapy, family psychotherapy, and works to integrate pharmacotherapy and alternative treatments to optimize brain health and function. And so he is open to accepting clients for ongoing care and utilizes telemedicine, including to in-person sessions. So Dr. Sood works closely within both our Amen Clinics New York office and Amen Clinics DC office. So thank you very much. And Maria, we'll have you introduce our next speaker.
It's my pleasure to introduce Dr. Eboni Cornish. She's a functional medicine physician at the Amen Clinic in Washington, D.C., located in Reston, Virginia. She graduated from Brown University undergraduate and Brown University Medical School. She completed her family medicine residency at Georgetown University. In 2003, as a Howard Hughes Medical Fellow, Dr. Cornish conducted translational research at the National Human Genome Research Institute of NIH as an apprentice in the laboratory of Dr. Francis Collins, who's the current director of NIH and the leader of the Human Genome Project. Dr. Cornish is on the Physician Advisory Board of the Charles E. Holman Foundation for the newly emergent Mendel's disease. She's an expert in the treatment of Lyme disease, autism, chronic fatigue, genetic methylation disorders, autoimmune diseases, gut imbalances, environmental toxicity, bioidentical hormone replacement, biotoxin illness, mast cell activation syndrome, and fibromyalgia, among other chronic conditions. Dr. Cornish's approach to the treatment of chronic disease is to find the root cause of a person's health problems by performing a very comprehensive evaluation of the body's various biological systems. She understands that all of these systems are interconnected and contribute to the emergence of disease as well as its resolution. Her paradigm is based on the evolution and the evaluation of both environmental and genetic predisposition to disease by incorporating evidence-based treatment approaches as well as integrative strategies for healing. She has combined her passion for patients' advocacy, interest in chronic illness, and extensive genetic research experience at NIH to manage the challenges facing her patients.
Okay, so I guess I'll get started. Dr. Cornish's bio is pretty impressive. Lots to live up to. I want to first thank Maria, Donna, and Kathleen for putting this on. It's an honor. It's a privilege. Much appreciated to be able to share this platform with Dr. Cornish, so we can deliver some meaningful outlook to kind of what we do and during a difficult time. So what I'm going to do is share slides that we put together, and let me pull up the screen. Today we'll talk about our process at the Amen Clinics. We'll talk about why SPECT scans are important. We'll talk about certain brain regions that can affect behavior and mood. And we'll also talk about a patient case that was challenging and one that required an integrative approach. And so we're going to have Dr. Cornish join us for that. So at the Amen Clinics, we look at client from many perspectives. And we not only take a clinical history, we also have clients perform neuropsychological testing, and we look at their brains. So how do you know without looking? That is the philosophy at the Amen Clinic. We want to know how your brain works. And so rather than guessing, we use SPECT imaging to help us with that. And in many cases, our treatment goes beyond holistic approaches, lifestyle, such as nutritional approaches, exercise, supplements, medication. In many cases, we rely on our integrative doctors to further examine facets of an individual's functioning that could be contributing to their illness. We look at the brain and we look at the client using a 4 circles approach: biological approach, a psychological approach, a social approach, and a spiritual approach. So we really want to help the client flourish in all of these domains. There's not just one domain that can help someone in their recovery. We believe that eating well is essential. We believe that moving is essential. We believe that how your sleep is essential. We believe in helping you with how you think, finding purpose, finding meaning, engaging with others, in your journey to recovery. We use imaging, SPECT imaging, which is a functional scan, which looks at blood flow. So SPECT is looking at activity. We want to know, is your brain working too hard? Is it not working enough? Is it working just right? And then we want to examine those areas further and come up with a treatment algorithms that can help you kind of feel better. So the image on the left is a healthy surface view of the brain. The color is not important. What matters is how smooth the surface is. So the individual here is getting adequate blood flow. This is the image on the right is a picture of an individual's subcortical brain, so their active view, so the emotional circuitry. And we have a healthy amount of blood flow in the back, where that majority of that red is, in the cerebellum. And we want to see lower levels of activity, more in the center and more at the top. So we look at the brain in terms of systems. And one of the most important systems in our brain is the prefrontal cortex. So this is our CEO and our supervisor. This is what allows us to pay attention. This is what allows us to delay gratification. This is what allows us to control impulses. So when the prefrontal cortex is working well, generally life is working well as well. Life is going well. So focus, forethought, impulse control, organization, planning, judgment, empathy, insight, learning from your mistakes are all functions of the prefrontal cortex. Another system that we look at is the deep limbic system. So the deep limbic system is what sets the emotional tone. It integrates sensory information. It helps us with bonding to others. It gives us drive with motivation. When our limbic system is working too hard, we often depressed. We're sad. We've lost interest in life. We feel guilty. We've lost energy. We're not able to concentrate. Kind of slowed down. We want to be by ourselves. Another system that we look at is the basal ganglia. You can see this picture that the basal ganglia are very active. So the basal ganglia, when they're very active, this tends to correlate with people who tend to worry, predict the worst. So the basal ganglia is another system we look at. So we look at the prefrontal cortex, the limbic system, the basal ganglia. We look at a few other systems that we won't talk about today. The temporal lobes and the cerebellum and the cingulate cortex as well. So that's a little bit about SPECT. So now we'll focus on a patient that Eboni and I, Dr. Cornish and I, have helped. And this is a 60-year-old male who has a history of substance abuse, chronic Lyme disease, and depression. And it was his depression and his decline in cognitive function which really led him to seek help. He had tested positive for COVID, but he hasn't been hospitalized and he's not endorsed any symptoms related to that. So he started experiencing a decline 5 years ago, and this was not like him. He was very motivated before this. He was very involved in the community, at work. He was a leader in his field. After he started developing the symptoms, he went to a naturopathic doctor, and he was diagnosed with a fungal infection, so systemic candidiasis. He was treated with herbs, supplements, and he felt better for a little bit. Then his further decline occurred. After going to the naturopathic doctor and feeling like that wasn't helping him, he went to psychiatrists and neurologists. Over the past 5 years, he's been on over 50 antidepressants. He has had ECT, electroconvulsive therapy. And despite having undergone these treatments, his condition continued and worsened. He endorsed suicidal ideation last year, and he was hospitalized for this. And what's really sad and perplexing is that he can't think of any sort of precipitating factors that led to this decline. It's just kind of happened, and he's had to deal with it. He really is focused on worsening cognitive function. He's not experiencing any mania. He's never experienced any, grandiosity or highs in the past. He does have a history of significant substance abuse. So for a decade plus, he was drinking quite a bit by himself. And he doesn't understand why he made that decision, because life was pretty good. He wasn't experiencing depression or anxiety at that time. He was also taking pain medication, Vicodin and Percocet, to numb himself. But again, he doesn't understand why he did that. He says it felt good. There's no history of an injury or pain disorder. About 4 years ago, he decided to wean himself off with the help of an addiction specialist, and he was tapered off of his Vicodin, Percocet, and started taking Suboxone. During that time, he was also started on antidepressants. No known head trauma. So this is really important. When client comes in, we want to know, have you had head injury? We want to really figure this out, because head injury has been shown to really impact mood, cognition. He adamantly denied it. We asked this question several ways at different times during the process, and he denied this. He does have a history of Lyme disease. He was diagnosed before the onset of his depression. He underwent treatment for this, 2 months of taking an antibiotic, doxycycline. So he's seen many clinicians, many psychiatrists, neurologists. He's in therapy, many naturopathic physicians. He's been hospitalized. He's really tried to figure out what's going on, and he's had to endure a lot while he's been through this. He comes back to cognitive decline. He really wants to think more efficiently. He wants to get his executive function back, his ability to organize and plan. His working memory is not where it was, so he forgets often what he reads. He's struggling with reading, writing, and speaking, and he's a speaker, national speaker. He denies any issues with activities of daily living. And on a memory test, he scores pretty high. So this is a Montreal, this is the cognitive assessment test, a MOCA test, and he scored really high on that. So if you just relied on this test, you would say, hey, you're just kind of, this is maybe you're kind of making this up, or, but as we'll see, his brain is not working well for him. And definitely can explain why he's reporting these symptoms. So with the onset of his depression, he's lost interest in things he once enjoyed. This has become worse. Earlier in his depression, he didn't have any issues with sleep. Now he does. He wasn't experiencing suicidal ideation. Now he is. He continues to experience that. He's now experiencing decrease in energy. He feels like he's a burden. His wife's super supportive. He feels like he's letting her down. And when he does feel depressed, more depressed, he experiences a numb, tingling experience, and he says his tongue becomes white. So his goals are to really get to the bottom of this, to get a comprehensive workup for depression. He wanted to get off medications and was open to medications and wanted to figure out if needed, and wanted to understand whether the medications were making him worse. He was open to any recommendations to improve his mood and cognitive function. He was desperate. He said, we are his last resort. So we do neurocognitive testing. We do a test. We have the client perform a test. It's called Web Neuro, where we look at clients' thinking. We're really focused on their motor coordination, processing speed, sustained attention, controlled attention capacity, capabilities, working memory, executive function. And when we're looking at these scores, we want to really thinking about their frontal lobes. Are their frontal lobes working well for them? And as we can see, he scores low on many of the measures. He scores very low on the feeling and self-regulation measures as well. So he's super stressed, he's anxious, he's depressed. He tends to think more negatively. He's lost his resilience. So, before, when a crisis would sort of emerge, he would see it as something that he could overcome. Now he sees this is a crisis that is insurmountable. He is unable to make decisions. So his resilience is really, low. And he has no desire to socialize. And he's a very when you speak to him, he's very engaging. He wants that desire back, but he just has no drive at this time to be with others. So we have the clients complete a brain systems checklist, and his prefrontal cortex, he reports that he's really struggling from a frontal lobe standpoint, prefrontal cortex standpoint. He has trouble listening. He has trouble completing tasks. He's making careless mistakes. He's not able to sustain attention, easily distracted. He's not able to plan. He feels spacey. He feels like he's in a fog. Another brain system that is overactive for him is the cingulate cortex. So this is a part of the brain that when too active, people tend to overfocus, get stuck. It's very hard to let things go. In many cases, they understand that their thinking is irrational and they're thinking in a circular manner, but because this part of the brain is working on overdrive, it's very hard for them to kind of let go. We can see that negative thoughts are repetitive. He gets stuck, and as a result, it's difficult for him to shift attention. And family members are reporting that he worries more than he did. The emotional brain, the limbic brain, is on overdrive as well. He reports feelings of moodiness, feelings of negativity. He's lost interest in others, extremely bored, feeling guilty. So when these symptoms are there, we think about limbic overactivity. The basal ganglia, we talked about this a little bit earlier. So this is what sets the body's idle. When this is really active, people tend to worry and predict the worst. And as a result of this being active, he's avoiding conflict more than ever. So after we have the client, we take the history, we have them do the brain systems checklist, the neurocognitive testing, we have them undergo SPECT scanning. So again, SPECT is looking at function of the brain, whereas like CT or an MRI is looking at the structure. We're looking at the function, we're looking at blood flow. So we can see that his prefrontal cortex is low in activity. Another part of his brain, the temporal lobes, are low in activity. There's scalloping, which we'll talk about a little bit later. There's high activity in the thalamus, that's also known as the limbic system. And there's a lot of activity in the basal ganglia. So when we're doing SPECT, we want to see what the person's brain looks like in a resting state and what the brain looks like in a concentrating state. This is a slide that kind of describes the function of the temporal lobe. So when the temporal lobes are not working well enough, people tend to experience learning problems, reading comprehension struggles, auditory processing problems, irritability, anxiety with little provocation. So this is what his brain looks like in the resting state. So this is the surface of the brain. Again, the color does not matter. What matters is how smooth the surface is. So this is the scan that led me to say we need to get Dr. Cornish involved. When the resting scan is low in activity, to this degree, we think about infection, we think about toxicity. So had I not seen this, I may have not made the decision to refer our client to Dr. Cornish. So this is a major finding, which I think has really led to improvement for this client. And when this client saw this, his words were, I'm not just making this up, something along those lines. My brain's not working for me. And with that, there seemed to be more of a spark. He was more enthusiastic. He was more forward thinking. He was like, okay, there's something we can do about this. And what's incredible about his brain is that when he concentrates, his brain activates. There's more blood flow. But his issue is that he cannot get his brain to concentrate because it's so shut down at rest. And when he does get his brain to concentrate, his frontal lobe is still shut down, so it's hard for him to pay attention. As a result, he goes back to a resting state brain. We also see that in the concentration state, his temporal lobes are low in activity. And so he did report that he would feel anxious with little provocation. He's very irritable. So see this, dark thoughts and irritability when there's decreases in the left temporal lobe. That's depicted by where the right arrow is pointing. This is an active view, so we're looking deeper in the brain. And so this white dot, this area, is showing us the limbic system. And this is showing us that his limbic system is on overdrive. So this is our reptilian brain. His reptilian brain is just taking over. When he goes to concentrate, the reptilian brain continues to exert its force, and then that basal ganglia, just right above and to the right of the reptilian brain, the limbic system, is active as well. So when he's going to concentrate, he's not only feeling depressed, his anxiety increases. So what did we decide to do to help him? So a few lifestyle changes. We want to decrease inflammation, anything that could drive infection, that could affect brain health. So he eliminated simple sugars, gluten and dairy. He adopted a paleo keto diet. He said he couldn't live without coffee. So we worked to wean this off and get him towards more of a matcha green tea. And for detoxification purposes, some lemon water. He was already doing yoga, so that was great. Yoga can really help the basal ganglia and the limbic system calm down. So we continued that, and then we recommended some high-intensity interval training, 15, 20 minutes, 3 times a week. We started him on supplementation. We were not going to do medication. He had failed medications, and looking at his scans, it seemed like there was something else going on. And so we wanted to kind of support his healing by using some really good supplements, so omega-3s, happy saffron, GABA calming support, magnesium, St. John's wort, and tyrosine. And the sequence is important. We always want to work on calming down those active areas, so the cingulate cortex, the basal ganglia, the limbic system, and working on the temporal lobes before we go after the prefrontal cortex. We recommended hyperbaric oxygen to increase oxygen in his brain. As we saw earlier, the surface scans were decreased in activity, and we found that one intervention that can help this is hyperbaric oxygen. So at a pressure of 1.3 atmospheres for 40 sessions. The major treatment recommendation that we felt at the time and has led to significant improvement is the referral to Dr. Cornish. So we've recommended SPECT. So we like to look at the brain after treatment's been done for 8 to 12 months to make sure that we're heading in the right direction, and also show clients that you can change your brain, you can heal your brain. So I'm gonna hand it over to Dr. Cornish.
Okay, so thank you for that. And one of the things that I really love about this clinic is the ability to collaborate with doctors like Dr. Sood and our other psychiatrists to treat the root cause of neuropsychiatric symptoms, because that's my job as a clinician. Starting in family practice and then transition to integrative medicine, I always love to treat the cause. I think of myself as a detective. I'm always asking, but why isn't that person better? And I started my collaboration with Eboni Clinic about 11 years ago, where at my private practice at that time, the chief psychiatrist at that time here in our office in Virginia, their daughter actually had severe neuropsychiatric manifestations of disease, and also was found when she was tested at our practice to have Lyme disease, and we treated her and she got remarkably better. So there started that collaboration with Eboni Clinic, which has strengthened over the years to the point that I've now merged my private functional medicine practice with Eboni Clinic to be here full time. So it's a great joy and delight to be with you all today. And now we're going to take this a step further, because as Dr. Sood said, I would get consults from all the doctors like this, and you want to know, well, why? Why isn't this person getting better? So I'm going to walk through you kind of the different stages of which I evaluate a patient who does have neuropsychiatric symptoms or any symptoms from a functional medicine perspective in order for us to really optimize brain healing process. So I'm also going to show my screen at this time. All right, so when we're thinking of having an integrative management approach, you look at everything, right? So Dr. Sood did an excellent job with nutrition and starting him on the plan with exercise, but you also have to ask about rest. You know, people need that mental rest and that mental support. They need to make sure they're sleeping. And I always tell patients, if you're not sleeping, your body's not healing. And you really want to make sure the toxic load is something that you're reevaluating for. So when I'm screening a person for toxins, especially with someone who has a scan like the patient we're describing today, I'm thinking, this person didn't tolerate treatment with the normal route of neuropsychiatric drugs. So maybe there's something deeper. And as Dr. Sood said, we're luckily have the ability with our SPECT scans to determine if something deeper or a functional component is on our differential diagnosis. So we think about mold toxicity, we think about chronic infections, we look at the immune system, the liver, the genetics, the hormones and metabolism, and the gut function. And when we are doing a functional evaluation, the patients already have had the initial screening labs prior to coming to my office, which looks at a lot of these metabolic imbalances. So not only do I have the benefit of having the psychiatrist's report and the SPECT scans, but I'm also able to start the treatment journey with some basic labs that give me a good outlook on the patient, as well as their extensive medical history. So for him, we looked at his hormones because typically when we're treating patients, you want to start with the foundation of healing. So I always tell patients, if your hormones are imbalanced, if your gut is imbalanced, and if we have toxicity, it's really hard for me to dig deeper and eliminate that causative factor that's contributing to your current symptoms. So you have to look at medicine and as patients by taking a systems approach. So looking at his hormones, which is his endocrine system, we saw that he had a history of hormone imbalances. He had low testosterone. He had high cortisol due to stress. He had borderline low thyroid function, and his management was to have some hormone stabilization. We also sent him a test so that we could accurately screen for his cortisol throughout the day. So because the cortisol is that stress hormone, when we have adrenaline, it's released. It makes us anxious. It makes us scared. And at times, the human body can produce cortisol at high amounts 24 hours a day. And that could be a sign of what we call adrenal dysfunction. And the problem is when your cortisol level is up all day, then your body loses the ability to support other systems in the body. So you may have high levels of cortisol, and that contributes to low sex hormones or low hormone function like thyroid or insomnia. Some patients have high levels of cortisol while they're sleeping. So the brain should be resting, but at the same time, you have this adrenaline cortisol that's working, and that prevents you from getting a good night's sleep. And then over time, if that cortisol continues to rise and it's not controlled, then it gets what we call burnt out, which is like stage 3 adrenal fatigue, where you just have that wired but tired response, but that cortisol level is now flat because you've used all your reserves. And so some of the easy things we do to stabilize your cortisol, we start with the basics. If you're not doing mindfulness, if you're not having regular sleep patterns, your brain isn't going to heal. And it's been shown in the literature that having mindfulness daily, either 10 minutes, can help reset that cortisol response and can be healing to the brain. So those are kind of techniques I worked on with our patient at our initial visit, and really wanted to get an understanding of what his adrenal imbalance had showed, and gave him some solutions for that. And then we talked about the second brain, which is one of my favorite areas. When I first started working full-time with Amen Clinic, I did a presentation for the psychiatrist on our doctor's call called the gut-brain axis, because this is key. I mean, you are what you eat. The gut and the brain are connected by the longest nerve in our body, called the vagus nerve. So if you damage your gut, it's no different than damaging your brain. You may have heard things like irritable bowel syndrome or leaky gut. Well, all of that means is that those toxins that are going to the gut are unfortunately leaking out to the bloodstream, causing inflammation, which can then lead to brain inflammation. So he had a lot of things from his history that showed that he had impaired gut, or what we call leaky gut. He had a history of chronic yeast infections. Yeast lives in our gut, but when our gut is leaky, or that membrane that surrounds our gut is impaired, yeast can lead and leak out into the body. All right. That's what we call systemic yeast that's in the system. It becomes more widely associated with other disorders that we'll discuss later. He also had a diet that was poor at the time of his appointment, which was rich in sugar and gluten. He was having, irritable bowel symptoms, constipation, diarrhea. His glucose wasn't in the best controlling. He had a history of high cholesterol. And so I'm like, oh yeah, this is one of the reasons why this patient isn't better. And of course, when you don't feel well, you're going to not make the best choices for food. But I knew that this was imperative that we kind of started to help heal this second brain. All right. And this is just showing that inflammation and depression can be caused by poor diet or leaky gut, stress, obesity, and vitamin D deficiency. So all of this contributes to the inflammatory mechanisms in major depression. So he had already been prescribed for his GI management, the ketogenic diet. I also had him do a food inflammatory study, and he did a 7-day liver fast for me, which includes 7 days of good gluten-free grains, vegetables, and low sugar fruits for a 7-day window. And that allows the liver to kind of reset itself. You're not eating sugar, you're not eating meat, you're not eating dairy, so you're not introducing a lot of those toxic foods into the body. And it kind of gives us what I call a reboost, like a boosting of the gut, and also decreasing inflammation. We tried to remove all the toxic foods, so we went through the list, and I started to give him some healing for his gut. So we started replacing what we call digestive enzymes, which help break our foods in smaller particles. I also tried to help heal the gut, gave him some supplements to help make that gut more whole so it was less leaky. We started him on a probiotic, and we also started him on other antioxidants. And this is just an example of the food inflammatory study. And this is not an allergy study, because food allergies are very controversial. This study is one that I've personally done, and I really appreciate it because it looks at foods that are inflaming you at that point in time. And what that means is by eating the foods on the list, you're going to cause systemic inflammation and, more importantly, brain inflammation. So you want to make sure as much as possible that the person refrains from those foods for a period of time as you work to aggressively heal the gut, so that they eventually, if the foods aren't toxic, can reintroduce them at a later date once you've achieved some gut stability. And we talked about some of his other labs. We said with the elevated liver enzymes, we wanted to discontinue alcohols or any drugs. We started him on liver supportive agents. And I checked for other causes of liver dysfunctions, including other bacterial and viral causes, things that can inflame the liver, because the liver is our major detoxification agent. That's how we push all the junk out. Everything we eat, breathe, smell, touch is toxic, just about majority, right? So you have to work hard at clearing it. And that was something we discussed in detail. And there are also nutrients and supplements that we use to help with just improving your body's ability to clear out toxins. And things like infrared sauna, Epsom salt baths, things as simple as putting lemon in your water in the morning, squeeze a little lemon in 4 ounces of water. That's a great surge of detox to the liver. Green smoothies with things like kale and other greens can be helpful because the liver needs those kind of leafy, cruciferous vegetables. Physical therapy or exercise, and as I said, nutrients or supplements. And then we thought about the chronic infections, because as I said, there are stages to healing, and you got to work your way down, because if you just jump, and if I would have just said, oh yeah, he has Lyme disease, let's start treating his Lyme disease, before we kind of made sure we address the hormones and the detox and the gut, we would have a much harder time getting his infections in remission, because we know chronic infection causes chronic stress. It leads to non-restorative sleep. It can also cause cognitive impairment by decreasing your body's regenerative functioning. It can compromise your immunity, cause what we call oxidative stress, which is due to toxins, and it decreases your resistance in general in your immune system. So his lab results, we already knew that he had exposure to Lyme, but he also had other co-infections as well when we did a very comprehensive analysis, and he had some chronic viruses. He had old labs from a naturopath, which had showed elevated candida titers. And when it comes to Lyme, he, of course, as we alluded to, he didn't really have a lot of those typical Lyme symptoms. You may think of someone with a rash and joint pain, muscle pain. He had neuropsychiatric symptoms associated with Lyme disease, and that's across the board, including things from schizophrenia, bipolar, panic, depression, and the like. Those are all been associated with Lyme disease. Can primarily present itself as neuropsychiatric. And as a member of International Lyme and Associated Diseases Society Educational Foundation, I'm a board member, and one of my jobs is to train other doctors around the world on how to treat this condition as a part of our physician training program. And we provide numerous references because I'm a researcher in heart, and I feel like even when we're treating functional medicine, it needs to be rooted in some good research, just like our SPECT scans are. And we have conferences every year with my organization on just psychiatric Lyme because it is so prevalent in the community and misdiagnosed. So what are some of the symptoms? Well, sleep changes, insomnia are very common, irritability. We call it Lyme rage. We'll have patients who, oh my, grandma was the nicest person forever. And then all of a sudden, things change and it's a very angry person. It's consistent with Lyme rage, and it's a consequence of this underlying infection. And then depression and mood swings, panic. Some people have like air hunger, or this feel of dying, or just bad anxiety. And you can see psychoses. I've had patients with delusions, hallucinations, and then some psychiatric symptoms. There's some research showing that patients with tick-borne diseases have higher rates of substance abuse. And other things that are very important to note are some of the cognitive impairments, because I think that some of the cognitive impairments or brain fog for our patients who have neuropsychiatric manifestations of disease are kind of connected. Because if you're having poor memory or function or language issues and functioning, or also auditory and mental tracking and problems with memory retrieval, that can definitely affect your mood. And also, it can affect your diagnosis. I see a lot of patients who have neuropsychiatric Lyme disease and make it misdiagnosed with Alzheimer's, or we've even had patients with multiple sclerosis or Parkinsonian features. So Lyme is kind of the great imitator. It can mimic a lot of other conditions. But then when you say Lyme, it's a huge list of co-infections that are also associated with this disease process. These are just a few of the most common, all of which had been screened for our patient either by myself or by other providers. And all of these co-infections can be associated with neuropsychiatric symptoms. And Lyme is clinical. It means I'm going to treat a patient based on what I see in my office, their vitals, their history, and other clinical manifestations of disease. So just briefly to discuss a few of them, the most common one I see at the clinic, and one he had said he tested positive for, was babesiosis, which is a tick-borne parasite. Then it's different from bacteria, so it's treated differently, but it's still a co-infection of Lyme disease. So air hunger and depression, but really severe mood changes and swings and sweats and chills. Bartonella is one that is a bacteria associated with neurological manifestations of disease. So you have lymph node enlargement or brain fog, Ehrlichia. These patients have a lot of problems with their liver enzymes. So that was definitely one that I screened for all my patients who have liver enzyme abnormalities. Rocky Mountain spotted fever is very common, associated with fevers. And then mycoplasma is the last one associated with fatigue and cognitive problems. And as you can see, these symptoms are nebulous and they kind of overlap. So you really want to be that detective if you think that chronic infections or specifically chronic tick-borne disease is a contributing factor. Now, chronic tick-borne disease is very controversial in its diagnoses because you have two different schools of thought. So you have what's called International Disease Association, which it says that if you don't have a tick bite, this is the IDSA, or if you're not better after 2 weeks of antibiotics, it's called post-Lyme syndrome. They also don't believe that chronic Lyme exists, but it's due to something else. Versus my organization, which is ILADS, International Lyme and Associated Diseases Society, we think that Lyme is chronic and it contributes to chronic symptoms like fatigue and joint pain and neuropathic pain. If I was under the schools of thought of the IDSA, if I had a Lyme patient and they had already been treated like he was with doxycycline, I wouldn't even consider Lyme anymore. But understanding that this can be a persistent illness made me keep that on my differential. And also the testing for Lyme is very, very flawed. And that's because there are so many different strains of the organism. There are co-infections. There are resistant forms. This organism can change its physical characteristics. And a lot of times patients with chronic tick-borne diseases have a really low immune system. And the tests that we perform for chronic tick-borne diseases are immune assays. And what that means is it requires that your immune system is robust enough to send a signal that you've been exposed. And typically, the standard Western blots that are done at LabCorp and Quest, they miss about 40% of patients because the tests are so poor, and so we use other standards as well. And this is briefly showing you that there is evidence. As I said, I love research. And we've been able to prove that we have evidence-based guidelines from my organization. It's been peer-reviewed. And also that chronic Lyme disease is a disorder. It's not post-Lyme disease. It actually could be a relapse of a chronic infection. And in our patient's case, a neurological infection. But we also mentioned his history of yeast. And yeast can also cause psychiatric disorders. And that was something that I found out years ago, and I was fascinated because I started to see quite a few patients who had sugar cravings, like this patient did, and like a white tongue and thrush, and were very depressed and anxious. And when we started to treat with antifungals in a yeast protocol, their mood got better. So it's been associated with depression, autism, anxiety as well. And then Epstein-Barr, chronic mononucleosis, of which our patient had. He had had exposure to mono years ago. And then when we tested his labs, his titers were extremely high, which in some cases may indicate that because of the nature of his immune system, a previous exposure had actually reactivated. And in fact, when you get those tests screened by your Epstein-Barr tested by LabCorp or Quest, they will actually have a differential and tell you this might be reactivation, which it was in his case. And as we can see, these viruses also cause depression and anxiety. So it's important that you do a really good investigation of infections and other toxins when you're treating a person with resistant neuropsychiatric symptoms. Another common thing we see at our clinic are patients who are affected by toxic black mold or mycotoxin illness. Because as you see here from this list of symptoms, a lot of them are neurologic: brain fog, weakness, problems with focus and mood swing and depression. I see this on a daily basis at my office. Patients may not even know that they're living in a moldy environment, or they may have genes that prevent them from clearing mold out the body. So they might be exposed to a water damaged building years ago. And because genetically they're unable to clear mold out their body, they start to retain those mold toxins, and they eventually cause neuropsychiatric and neurological symptoms that can be quite debilitating. But that's something else we could evaluate and treat. So when you're evaluating mold toxins, you want to do the home and the urine. And we're waiting for his final urine results, but we most likely, if it is high, as I think it will be because of the exposure, will start mold management. And the first step in management of mold illness is making sure your environment is not toxic. And if it's toxic, remediating. All right. And you can also use treatment or binders and liver support to remove mold out the body and out of the cells. Other things that if he, in the future, we might consider are IV detox. Here at our Reston clinic, we have an IV detoxification program as well as a clinical program where we do 3 different types of detoxification IVs. We use what's called glutathione, which is the body's major detox, and it removes all the toxins from the liver. And it can be provided orally, or it can be provided nasally, or it can be provided topically. We also use Myers cocktails, which are B vitamins that really help with liver support and with mitochondria, your energy. And then high-dose vitamin C, which is anti-inflammatory and also helps with pain, all right? And we do things also like fluids and the like. So for this patient, we have a lot of next steps because I tell everyone when we're dealing with neurological manifestations of infections, this is a marathon and not a sprint. We're in this for the long haul. We're in this to recover your brain. We're in this to fix your mood, to fix your relationships. We're in this to treat the underlying causes of your disease. And that's why at our clinic, we're so wonderful to have that team approach with great psychiatrists who also understand the importance of treating a patient naturally, and also integrative doctors. So we work hand in hand. And this patient is currently taking antibiotics for Lyme disease. He recently restarted it, may need additional therapy in the future. We will continue to manage his underlying metabolic abnormalities. Dr. Sood talked about limbic system, and there are certain programs out there that we may consider later for limbic system retraining. There are several different programs. One I use quite often is anti-hopper. It's just a way to reset the brain, and I find it very useful for patients who have chronic conditions like tick-borne diseases and infections, and also chemical sensitivities. We'll evaluate his complete evaluation for mold and of his home, continue to treat his gut, improve overall detoxification, and we're waiting for, he actually has heavy metal toxicity, so we'll start that process as well. But it's a stepwise approach. You can't do everything with a magic wand, and it does take a team approach, and that's why I'm so lucky to be here at the clinic, because that is the approach we use. So, and that's the steps with our patient.
Thank you very much, Dr. Cornish and Dr. Sood. So everyone stay on the line because we're going to open up for questions and answers at this time and transition it. So you can ask your questions here live from the physician experts.